There's a story I think about sometimes. It concerns a Chinese woman, and she developed mental illness as an adult. And she didn't understand what was happening to her, and her family didn't understand what was happening to her. Her employer didn't understand what was happening to her. And soon she couldn't cope at work, and she lost her job. And she couldn't cope with her family, and she lost her family. And she found herself on the streets trying to survive, and she was assaulted while on the streets. And when she thought that things couldn't get any worse, luckily she was found by a mainstream agency who could see that she was suffering from mental illness. They gave her a diagnosis, and they gave her medications for her treatment plan, but they also referred her to ACRS because they thought that she would need to get on her own 2 feet, and they knew that we had an employment program here. Our staff, who spoke her language, understood her culture, could see that she was still suffering with mental illness, and they connected her with a psychiatrist who spoke her language and a mental health case manager who spoke her language. And they were able to determine that she had been misdiagnosed, again, due to the language and cultural barrier. And when she was on her new treatment plan, she said it was as if her mind had been in a cloud, had been in a fog for years, and suddenly the fog lifted. So she was now able to prosper because she had the correct treatment plan, she had the correct medications, she had the correct nutrition, she was able to get job skills, and as a result, she was able to stabilize and to rejoin her family. So it's just a reflection of how important language and culture are in making sure that services are not only accessible, but that people receive the right diagnosis and treatment plan.